Hi, my name is Camille, and I studied somatic therapy interventions for trauma, specifically for PTSD. And the reason why I chose this is my own personal experience in using yoga as a way to heal um, in from traumatic events. And often somatic symptoms come up in different mental health illnesses, definitely in PTSD or anxiety, depression. And this can be like having anxiety and your stomach hurts, or you get a headache, or your heart starts to beat really hard, or your shoulders start to hurt, or your back. These are all somatic symptoms. And when a person's in chronic stress or has chronic mental health illnesses, they might have these chronic somatic symptoms, and this can cause long-term um, health complications. So, what I wanted to do was kind of look at what somatic therapy interventions are available out there, what is being researched right now, and what do we know about their efficacy? Because often in Western medicine, we separate out physical health and mental health, or even spiritual or community or social or cultural health. Um, and this somatic therapy kind of is a way to bring those all together, a more of a holistic way of healing. Um, and so what I ended up doing was do a systematic review. Dr. Arroyo helped me with this, and we compiled 406 articles, and we got down to seven. So our inclusion criteria was that it had to be using a somatic therapy intervention, um, and it had to be specifically studying PTSD. It could also have anxiety or depression or other symptoms along with it, but PTSD had to be the main focus. And so we use different quasi or RCTs studies that compared a somatic therapy intervention to maybe wait list or treatment as usual or other modalities for PTSD. And while I was doing this, I kept track of what somatic therapy interventions were just in the literature in general. And I kind of have this graphic here that helps show what are the main ones that are being used. So EMDR is considered a somatic therapy. It's quite popular right now. There's also somatic experiencing, sensory motor psychotherapy, dance and movement therapy, cultural related approaches, yoga, somatic and nervous system regulation, art therapy. There's a lot of different ones. Um, but the seven studies that we landed on, all of them actually showed they were in favor of somatic therapies being effective for treating PTSD. Um, and obviously, we're missing some literature. We looked for the past 10 years. So that kind of shows that more studies, more research needs to be done in this area. Something that could help is if the DSM-5 or the DSM-6, the future ones would include complex PTSD and any intergenerational, historical, cultural trauma. Um, that would definitely push the research in this direction of looking at more somatic therapy interventions, culturally inclusive interventions, because that is definitely something that can be a huge power and resource for clients who have cultural rituals, ceremonies, um, things like using dance in therapy, music, arts, using nature, using their spiritual beliefs. This can all be a really amazing tool to use in their healing. Another point of discussion was how cost effectiveness, the cost effectiveness of treatment, specifically for the clients, not necessarily the practitioners. They found one study found that EMDR was actually the most cost effective treatment, which I found interesting. And then the next was somatic and cognitive therapies. So, to conclude, I think integrating somatic elements into healing is so important because we experience not just cognitive pain, but we can experience physical pain, and those somatic symptoms. And it's also important to honor clients when they express that they're experiencing somatic pain. Um, they might go to doctors and say, I have a stomach ache and I have back pain, and the doctors can't find anything wrong with them. And that can be a sign of the trauma they've been through and the stress, the chronic stress that their body is going through. So, just to conclude, again, I think this could be a really cool thing to push in the future, push research to understand it more, to give more options to clients, to give them more choices and autonomy in their healing process, because often in traumatic experiences, there was some form of autonomy that was taken away. So. Yeah, that's kind of all I have to say. Thank you.